Hi, I'm Andrew, Unison's health planner. This video provides an introduction to evidence-informed practice at Unison. Over the next few minutes, we'll explain what EIP is and why it's important. You'll also learn about when to use EIP, how the process works, and where you can get support. EIP is a systematic approach to planning and evaluating group programs and service delivery processes, based on best available evidence and organizational values. It's a collaborative peer review process. Let me introduce Paulos, one of the people who helped to create EIP at Unison. He'll talk about how the EIP process came about.
About 10 years ago at our organization, we were having a discussion about how to actually be even more invested in our mission of delivering accessible and high quality health and community services. For our colleagues in primary care, it was a fairly simple, straightforward answer. They defined themselves as wanting to invest deeper into evidence-based medicine. For those of us that were in the community health promotion side of the organization, the restrictions of evidence-based medicine with its reliance on clinical data was not something that was relevant or applicable to our work. And we realized that we needed to develop a whole new approach that included input from community members, those who have lived experience. It included anecdotal information and experience from our providers, as well as the body of evidence that did exist with regard to community health services. Tools and protocol came about because we needed to operationalize how we were actually going to go ahead and deliver on high quality and accessible community and health promotion services. We needed to begin with defining what we meant by evidence-informed practice as opposed to evidence-based medicine. And so we knew that what that meant for us was including other bodies of expertise and information that was not included in the clinical or codified evidence that exists for medicine. And that required all of us to participate in building a set of tools and resources that were generated either by our own staff and volunteers or by other practitioners in similar settings in other communities.
There are different kinds of evidence that can be applied to program planning. Contextual evidence, or knowing the community, research evidence, or reviewing the literature, and experiential evidence, or drawing from individual experience. Why do we do EIP? First, to ensure that programs and services are effectively responding to community needs. Second, to ensure a consistent approach to planning and evaluation across the organization. Third, to help staff reflect upon, make decisions about, and improve our programs and services. And fourth, to promote a culture of quality improvement, learning, and innovation. When do we do EIP? We do EIP when we identify a community issue or need that we want to address through a new program or initiative. We also use the EIP process to review existing programs on a regular basis. Some of the EIP tools can also be useful for conducting needs assessments, completing funding proposals, and for ongoing quality improvement. There are some situations when you're not required to use the EIP process. For example, EIP is not used for most of our individual client services, such as primary health care, counseling, legal, or housing services. Second, EIP is not normally used for one-time workshops or information sessions, and it does not apply to community events such as barbecues or volunteer appreciation events. Finally, the EIP process does not apply for programs or service initiatives where Unison is not one of the lead agencies. Now that we've given a bit of background about EIP at Unison, let's see how it works. When you're designing a new program, be sure to allow enough time to complete the full EIP process. You shouldn't start your outreach for a new program until the complete EIP process has been done. There are 4 major steps in the EIP process. First, you complete the program development request form. This applies for new programs. Second is the program design phase, for which you'll use the program planning template. Third is the peer consultation meeting. And fourth is a discussion with your manager. Now we'll cover each step in more detail. If you have an idea for a new program or service initiative, you'll start by completing a program development request form. You can complete this alone or in consultation with colleagues or key stakeholders. The form is used to document your initial ideas about the program or area of need and to ensure that the idea fits within Unison's strategic priorities. Your manager will review the form along with the manager of urban health programs. Once the request has been approved, you can proceed to the next stage of the process. The next phase of EIP involves researching and designing a new program, or, in the case of existing programs, reviewing the program you're running. The first step in this phase is to contact the health planner. The health planner, or one of Unison's EIP champions, will be assigned to help you with this stage. The health planner and EIP champions are staff members that have knowledge and experience with the EIP process. They can discuss your program idea with you, and they can help you to complete the EIP program planning template. The template is a detailed description of the program. We'll be talking more about the template later in the video. Make sure you set aside enough time in your schedule to do this stage, as it can be very time-consuming. And it's recommended that you consult with others during the process rather than trying to do it all yourself.
So the EIP process really encourages you to talk to other people who may or may not be directly involved with the program, but I find that getting more perspectives is always helpful, at least to know that you're on track.
In the next stage, your manager or the health planner may give you some additional feedback on the template. Then, the health planner will organize a peer consultation meeting. The meeting is an opportunity for you to discuss and get feedback on your proposed program from other peers or staff members at Unison. We've heard from staff that this is a valuable chance to learn from the knowledge and experience of colleagues. Within a few days of the meeting, the reviewers will share their meeting notes along with any required or suggested changes to the program planning template. In the last stage, you'll fine-tune your proposal. This will include a meeting with your manager to discuss recommendations from the peer consultation meeting and to make any final changes to the program planning template. Your manager will approve the new program by completing Form B. The EIP process has a lot of benefits, but can also be very challenging. As we mentioned already, it takes a lot of time to do the process well. It's very important for you to set aside some uninterrupted time to work on the program planning template.
What I would advise another colleague who's starting the EIP process is to take a look at all the materials that you have to complete and know the sort of steps that you have to go through ahead of time, and make sure that you give yourself a good amount of time to get through all the steps. Because I found the EIP process is time consuming. There are some definitely benefits to going through the process, but you should just be prepared and work into your schedules to devote enough time so you can get it done without feeling rushed, and then you can get on to implementing your program.
So you might be wondering where you can get support with the EIP process. There are a number of staff who can provide support, including the health planner, Unison's EIP champions, as well as your manager. You might also seek out some support from other colleagues at Unison or from community partners. Placement students can also be a valuable resource when completing the EIP tools. In general, collaboration leads to better program design.
Let's take a look at the EIP program planning template. This tool is mainly used for new programs and for reviewing existing ones. There are 6 parts to it. The first one is the situational assessment. The second one is the goals and anticipated outcomes. The third one is the program design. The fourth one is the logic model. The fifth one is the evaluative learning plan. And the last one is monitoring and reporting. Make sure that when you get excited about this program, you have to make sure that you really do the groundwork before you start in order for the program to be effective and relevant for the participants that you're trying to deliver this program to. The first part is the situational assessment, which may also be considered as the detective phase. The situational assessment will answer questions such as, what specific issues and needs do you want to address? Who are your key stakeholders? What are the populations or groups that you want to reach? What is the evidence or best or promising practices? The second part is goals and anticipated outcomes, or the forecaster phase. Here you will describe the program goal and the outcomes or results you are trying to achieve. In this section, you will answer questions such as, what is the overall goal of the program? What are the short and medium-term outcomes that you want to achieve? What indicators will you use to measure your outcomes? The third part is the program design or architect phase. In this section, you will describe in more detail how you plan to run the program. It includes questions such as, what are the main activities? What is the role of partners in the program? How will you make the program accessible and create a safe space for participants? What are some possible risks and challenges you may encounter? The fourth part is the logic model or the artist phase. The logic model ties together key elements of the program in a visual way. This step is recommended but optional. The main components of a logic model usually include inputs, target groups, activities, outputs, and outcomes. The fifth part is the evaluative learning plan, or the community researcher phase. At Unison, we are committed to evaluating all of our programs and initiatives to promote learning and continuous improvement. We use the term evaluative learning instead of evaluation because it indicates an ongoing process of continuous quality improvement. Some of the questions you will answer in this section include, how and when will you collect evaluation data? Who needs to be involved in the evaluation and how? How and when will your evaluative findings be used?
Well, we use the evaluation findings basically to see, was our program successful? Is this something we would like to run again? Or, is there any sort of changes we should consider making for, this program or other similar programs that we might run? And we're actually thinking about, rolling out the Pathways to Nutrition program again. And we're going to use the evaluation as a way to, change anything that maybe didn't work as well, and also accentuate the parts that really worked well. So we're using the evaluations basically to inform, future programs, not just nutrition pathways.
I think I'm one or the veteran of EIP champion. I've been with EIP for I think since 2010 or since 2009. I'm not sure, but I'm a veteran. My role as EIP champion is to support my colleagues at Lawrence site, and I had a chance to support even other sites, Keelan Rogers, Bathurst, and Finch, in their program planning and in their evaluation. At the same time, I had a chance to do workshop on different EIP tools. As a health promoter, EIP process helped me a lot. One example I could give you, EIP is very systematic. So it creates uniformity, and at the same time with other colleagues, rather than one person doing one program, another person doing it another thing. So as a team, it created consistency, uniformity. Particularly when I look at my program, childcare training, childcare providers training program, went through EIP process. I got a chance to sit back and reflect about the program. Even though this program is ongoing program, it needs really time to go back and reflect. Because of that, I had a chance clearly to understand what the community members want to do and to get their information, their feedback, and to put into practice. So I see the quality improvement, adding the participants' feedback into the program. So it improves the quality of the program. And even situations are really changing. So I really used the program to improve, and it was a great experience.
The benefits that I've observed with the EIP process is that it allows us to have one consistent set of criteria with which to evaluate a very broad range of programs and services that we offer. Many of the analytical tools that our clinical colleagues, the guidelines that they refer to manage their work do not exist in community settings. There's a tremendous number of stakeholders and perspectives that we do need to take into consideration, and a whole host of barriers for accessing programs and services and for achieving healthy communities that need to be considered. The EIP checklist and tool gives us a very, very versatile set of resources to apply to any particular initiative that we're trying to develop. And I found tremendous value not only in the actual tool, but the capacity that's built amongst our EIP champions and our staff team who participate in the EIP review process. My advice to managers and staff who are considering or contemplating the EIP process is to look beyond how large or how intimidating that it might seem. Many of the questions are deceptively simple. We have tried to use clear language, but there's a real significance to going through in a very systematic way the entire process. I do encourage everyone to review at least the checklist, and in particular the section of situational assessment, because that is the genesis for any new initiative or program that is being started, or a great way to loop back and evaluate what the situation is before we actually invest in time and energy that may be wasted or that may be misdirected because those questions were not asked ahead of time. So I do encourage you to look into it. There are many of us who have already oriented ourselves or who may be able to offer you some advice on engaging with the process and with the checklists. So welcome to EIP at Unison.
Unison aims to make improvement and change part of everything that we do. There are two aspects to improvement. First of all, if there's something that we do well, then we want to celebrate it. We may want to sustain it, share our success, and possibly even spread it to other groups or programs or sites. Secondly, if we hear from our clients or our colleagues or from our data that there's something that we can improve, then we need to be open to that feedback and use it to drive change. We need to embrace improvement and change because our resources are limited and therefore precious. We have to choose carefully among various options what we're going to do that will move us closer to realizing our vision of healthy communities. EIP provides us with a process and tools that are very well suited to work with programs and groups that will help to guide us to choose wisely, to continuously improve, and to transform ourselves when our needs and circumstances change.
We hope that this video helped you to better understand evidence-informed practice at Unison and how it helps us to ensure that our programs are responding effectively to the needs of the communities we serve in Northwest Toronto. If you're undertaking the process for the first time, good luck. And remember that help is just an email or a phone call away.